Well, some health matters now. There has been an increase in COVID-19 cases recently, with more than 1,700 cases recorded earlier this month. The National Institute for Communicable Diseases says the Western Cape and Eastern Cape have recorded the highest numbers. Most infections were people aged 80 and above. Epidemiologist Professor Tulio De Oliveira joins us now just to help us understand what is actually driving this increase in the COVID-19 numbers recently. Prof, good afternoon. Welcome to today on eNCA. Thank you very much for your time. So what are you seeing? I mean, how should we interpret the recent increase in COVID-19 cases?
Good afternoon, then, and to all your viewers. Yeah. So what we have seen is in the last week, which what we call epidemiological week, we have seen a slightly uptick of cases, especially in the Western Cape. So we have seen around the 20% increase in cases, and also an increase in what we say the test positivity rate. Yeah. But also what we have been seeing in the Western Cape, and I'm here now just next to Tygerberg Hospital, the second biggest hospital in the country, in Cape Town, is that we have not seen an increase of hospitalization. We have not seen an increase on people that need ICU or being ventilated. So it's quite normal, and we did expect an increase of cases, especially as we finish the kind of festive seasons and we have children going to school. But so far, so good. The increase of cases has not translated into any extra hospitalization or deaths in the country, and especially in the Western Cape, where the increase in cases was 20% higher than the previous week.
Okay, the fact that we haven't seen any increase at all across the board in hospitalization is a good sign.
Yes, it's a very good sign. Yeah, and that's what we can see in this new phase of the pandemic. Yeah, and when it's that we have seen before, and we are seeing especially now, more specific around June, July last year, we had our last wave that was of Omicron BA4 and BA5, and that translating very number of hospitalization and deaths. Here now we are far from a wave. We are seeing like just a small uptick of infections, but no translation to hospitalization and death. Why that? The main reason is basic. Two main one. It's basic is first the population immunity from previous infection, but especially from the vaccination, especially vaccination in older age. And as you just highlight then before you interview me, we see that the number of infections is really growing in people with higher age, and that's a great time for people that need a booster. To really thinking about having but at the moment there is no reason to be concerned of this small uptick in case, and it's very good that South Africa is still keeping an eye on the ball of both of the testings and genomics in the country.
Okay, is there any particular variant or sub-variant of Omicron that's driving this?
No, so not at all. So we are still fully dominated by Omicron. We see these little sublineages that just Omicron, they keep changing all the time, but we do not have like a very specific reason for the growth of infection case. What we believe that maybe from really starting schools, and also because our government suggests the increasing in testing, especially people that test positive for antigen to confirm with PCR. That's what we get the numbers. So we can also sequence that and have the genomic surveillance. And we are seeing that across different diseases. At present, I'm much more worried about the measles outbreak that's happening in South Africa, than the COVID. And then again, another disease, another virus that's highly transmissible, and for which we have a very effective vaccine. And there's also a chance, especially for children, and the DOH and the NICD are rolling vaccination for measles at school, because we also need to control this outbreak, especially in Gauteng.
Yeah, and I know they've been doing that in a number of schools here in and around Gauteng. I've spoken to the MEC for Health, and just this past week, I know a number of children have been vaccinated against measles. In another development, Prof, before we conclude, I mean, not far from where you are, in Stellenbosch, I understand there's some exciting news. The university opening the largest genomics facility in Africa.
Yes, so it's very exciting. Yeah, we're gonna have a big opening, our official opening happen on the 19th of April. Yeah, because this is a very large investment. We have a big investment from both Stellenbosch University, but also from the Department of Science and Innovation. 1.5 billion rand in the construction of a state-of-the-art building that we are hosted. That, to be honest, today we just moved to our new labs, yeah, which is the big genomics facility in Africa. But more important, we also have like dozens of other scientific groups, and we're going to have over 1,000 scientists in this facility to really fight not only coronavirus, but also the scourge of HIV, TB, yeah, non-communicable diseases, cardiovascular medicine. And more important, this new building that's going to be open the 19th of April officially, yeah, also sitting next to the Tygerberg Hospital, which is the second big hospital in South Africa, but it's also the hospital in Cape Town that serves most of the poor and the resource limited communities. So it's a massive investment and very important for the country. But we're going to have a big official launch, yeah, in April, and I think that's going to generate a lot of excitement in South Africa.
But thank you for just giving us a sneak preview of that big launch. It's the only time I've seen you smile, Professor, when we interview you, when you mention these new labs. I mean, you just had this smile on your face. I'm sure it's good news indeed for yourselves and your fellow scientists. Thank you very much for your time this afternoon, Professor Tulio De Oliveira, just assuring us that though there's been an increase in the number recently of COVID-19 cases in South Africa, there's nothing really to be worried about. Omicron continues to be the main driver of these, and there's been mild symptoms, no hospitalizations at all of anybody who's been infected. But if you've been vaccinated, you stand a better chance.